Hi, everyone. My name is Solomay Tibabu, your host for the Going Digital Behavioral Health Tech Conference, and I am so thrilled to have Dr. Alfiee Breland-Noble here. And lots to talk about today, but right off the bat, Dr. Breland-Noble, can you tell our audience about you and your work and AAKOMA?
Sure. So thank you for the question, Solomay, and it's really an honor to be with you for this meeting. It's so important. So as you shared, my name's Dr. Alfiee Breland-Noble. Everyone calls me Dr. Alfiee because most of my work is with young people, and it's a lot easier than the hyphenated last name, so they just say Dr. Alfiee. And what I run, I founded something called the AAKOMA Project. It's a long acronym, but basically the word and the symbolism that goes into it has to do with a heart. It's from the West African Adinkra symbol, AAKOMA, with one A at the front. We have two A's at the front. Again, as I said, it's an acronym. And our focus is on uplifting, supporting, conducting research, and providing outreach and support for the mental health of Black youth, African American, and youth of color. That's really what we're about.
Amazing. And obviously, I can't emphasize how timely this is. Most of the folks in the audience know that this is a topic I'm very passionate about, especially as it relates to technology. And so how exciting that we can talk about how behavioral health technology could be the great equalizer for all sorts of communities. But,
Yes.
you know, I'm pleased that we can get together as a community for this event, but, you know, a lot of people are struggling right now. Kicked off with George Floyd, and my family is based in Minneapolis, and so a lot of people are struggling right now. What do you think the consequences of mental health are? Particularly in Black Americans, and help our audience understand that a bit more.
Sure. So we're in a moment that I'm not sure I ever thought I would see. And I'll explain. I don't know, I've been doing this for over 25 years. And so what I mean by that is I'm saddened for the circumstances that bring us here, right? So I do feel like we have to say their names: Breonna Taylor, George Floyd. There's so many people. I always acknowledge Christian Cooper because it was traumatic. Thank God it didn't end up in something worse for him as it was with our other brother and sister, but he was still traumatized by that, I believe. And so there's this idea of the collective trauma that has been experienced over years and years and years. And I would say for Black people and African Americans, and this is globally, as you've seen, the response has been, it's not limited to those of us who are African American and Black American. This is everyone. And in addition to the trauma, I think the mental health impacts have to do with coming to terms with the fact that as a field, right, in the behavioral health field, I'm a psychologist by training, right? So my training and my experience and my expertise is derived from probably about 20 years in academic medicine, first at Duke in the Department of Psychiatry, then at Georgetown before I left and founded my nonprofit. And in those years, there was this arc. So when I started, just like relevant to what we're talking about today, the conversation was that mental health in kids of color doesn't look any different than it does in anybody else. There's a tiny bit of truth to that. The issue with that is what we're seeing now, right? So there's this thread that ties all of it together. It's this beautiful, sad, at the same time, tapestry. And what it tells us is that there are unique experiences of racism, discrimination, institutionalized depression, and those types of things that more negatively impact African Americans, Black Americans, and people of color than they do white people. So we have to, I think we have to be honest and acknowledge these are the issues that we're struggling with. So for mental health, what this means is there have to be unique ways in which we understand and then begin to try to address the unique mental health needs of Black people and people of color. And I think that behavioral health technology, when built with all of these things in mind, can really be something that can move us along that path in the right kinds of ways. We're starting in many ways from the ground, and we have an opportunity to really build and infuse and make a strong foundation when we think about aspects of culture, race, ethnicity, as we build out these platforms and build out these tools to support people's mental health.
Mm-hmm. Yes, which is super exciting. And as it relates to opportunities on that front, do you think there are specific areas that could really make a difference, like youth in particular, perhaps?
Sure. So I'm thinking about some of the apps that I'm familiar with, right, that from the ground up are already thinking about how do we care for all young people's needs. So the two in particular that really pop to mind are the Not Okay app, these two young people, African-American kids from Hannah and Charlie,
Mhm.
wonderful young African-American, just beautiful kids and super bright. So there's the Not Okay app. And then there is Mind Right. So with those two, I think what I have felt from the beginning is because they have been developed by people of diverse backgrounds, they already have built into them those considerations, right? It's not an afterthought. It's not an add-on. We don't have to do an adaptation to get to the cultural piece. It's baked in. And I think that with both of those, what they, in some ways, Mind Right sort of puts it out front. I think for the Not Okay app, it's more behind the scenes and sort of seamlessly integrated into the app. So, with the Not Okay app, you push a button, you can reach any number of people who you already have programmed into your phone to tell them that you need help. Why is that culturally relevant? Because you know that mental illness is stigmatized in communities of color, right? So you don't want to say, I'm having a mental health crisis. You just say, I'm not okay. Think about that. That's how kids talk. I'm not okay. I'm in my feelings. To me, that has universal cultural relevance. I think for Mind Right, they're very focused on building upon the science that we know that's culturally relevant. That's what stands out to me. And so those are ways in which I think we have the opportunity for digital platforms and technology to be a great equalizer. Another one that I forgot is the Ayana app, Eric Coley, right? The whole purpose of that app is for literally everybody. Queer folks, people of color, they are the focus of the app. And so you're bringing people into the fold who probably in many ways would have never thought about mental health and mental health supports as something that they needed or wanted to be bothered with. And so you're pitching to people and saying, I designed this for you. Please come use it. And on the back end, they're benefiting from it. So to me, those are the ways in which technology and behavioral health tech can really, from the ground up, build in this idea of cultural relevance, in some ways, cultural competence to ensure that what people are getting is a good fit for them.
That's so great. And I'm just curious, from a clinician's perspective, do you think that, what's the stand on adopting technology for clients? Are we
Sure.
there yet, or?
Sure, I think so. I just think it varies. I don't know that we're there fully where you have everybody on board. I don't know we'll ever get there. I do think that for those of us who work with young people, in some ways, and because of coronavirus, right, in the pandemic, we've had to shift and more rapidly adopt technology than I think we might have otherwise. I can think there probably was a time when I was apprehensive. I think some of my own apprehension years ago was about I didn't understand the technology and how we could make it work. Now I see how much easier it's made my life. So shifting to, I have a tiny, tiny clinical practice that's always full, right? Because I'm an African-American woman. I'm clearly, you can tell I'm African-American, and people are seeking people who look like them, right? It's not just Black folks, but it's people of color. It's like, oh, I see that Black lady. I saw that Black lady on TV. Are you taking new patients? So it's sort of, people want something that feels familiar, and they want, if they are hearing you articulate, right, that you understand something about their background. I happen to know, because I went to graduate school in Wisconsin, that Minneapolis has a large Somali population, right? The fact that I know that lets somebody, there's sort of a signal to somebody, okay, she knows a little something. Maybe she doesn't know everything about my culture, but she knows that I come from a community in the United States where there were a whole lot of people who looked like me and shared my cultural background. That kind of cultural competence, that kind of cultural knowledge, I feel like is really critical. And I feel like is, one of the ways in which those of us who do this work can start to bring in and acknowledge and understand how technology can be useful to us, right? So I'm licensed in 3 states, or 2 states in the District of Columbia. Now that I have access to technology and I can work with patients through technology, that broadens and opens, right, the degree and depth and breadth of who I'm able to see. Whereas before, they had to physically be able to come to my clinic office for me to see them. So to me, it's all of those things. I do see a lot more of us adopting it. And because you have people like the Taraji Henson, her foundation, Boris Lawrence Henson Foundation, they're giving away free mental health support. Half of the people who signed up for that support had never tried mental health support before. They'd never been to therapy, right? And so through virtual, you're introduced, I'm a treatment engagement researcher, right? This is what I do. I don't know that I would have ever been able to come up with a way like she did to rapidly bring a whole bunch of new people into the field who probably would not have gotten there otherwise. So I think it's growing. I think it has these wonderful uses, and it's in it a lot of utility for us. We just have to figure out how to make it work well for everybody, to make it equitable.
Mm-hmm. Yeah, that's right. It was exciting to watch your piece on CNN with her, and just remarkable, using her platform to be able to draw new consumers to mental health
Yes.
who wouldn't have
Yes.
otherwise engaged. So amazing.
Yes. Yeah.
So those were some of the opportunities, but you did allude to some challenges.
Yeah.
Lots of challenges still, everything from stigma to how the tech is being developed. But
Yes.
let me ask you, what do you think are some of the challenges?
Yeah, well, exactly what you said. So there's stigma on the one side, right? On the recipient, on the consumer, end user side. I think there's also, I don't know if I would call it stigma. There are some biases that creep into on the developer side, how we build it, right? So there's always been this notion, even before, even when we were analog, right? When I started my career, I remember, all the times I submitted grants and thinking about the feedback. Some of that same attitude creeps into how we develop technology. So the idea is, okay, we love cognitive behavioral therapy, right? Let's build platforms based on cognitive behavioral therapy. But the problem, right? The problem is that for the cognitive behavioral therapy that has been tested, let's just stick with the United States, we have 0 randomized controlled trials that have large enough samples of African American, Latinx, Asian, Native, Arab, MENA kids where we can say definitively, absolutely, we know how CBT works for all these kids. That doesn't exist. I think there are 3 studies. The last time I looked, maybe there's a 4th. All 3 of those that I'm familiar with that have tested CBT in a large sample or larger sample, because large is relative, were focused on Latinas. That's important, but it's the girls. What about Latinx boys, right? And all the diversity that exists within the Latinx community. So we don't really know how well CBT works. The other problem is we don't understand how to keep people in treatment who are of color, right? So I think some of the challenge is when we're building the technology, for those of us who are developers, are we aware of these issues as we start building? I think sometimes no. I think sometimes people say, oh, CBT, everybody says CBT works. Let's build a platform based on CBT. Okay, there's usefulness of CBT. But if you're not, then the question becomes, and people wonder, well, we're looking at downloads and we're looking at analytics and demographics. And the demographics, either they have no idea who's using it, or if they do, they see these tiny numbers of people of color, right? Then the question, well, why aren't they using it? Because we didn't think about those communities when we were building the technology. So the example I always like to come back to is the putting your hand under the running water, like the automatic faucet.
Yes.
I'm chocolate girl, right? So when my hand goes this, now recognize my hand. I have to turn my hand this way to get the water to run. And when the first time an African-American person, actually, I don't think he was African-American, he was Black, I think he was African, explained that to me, I was all kinds of shocked, awe, and furious all at the same time. I'm like, how does that even happen? Like, how do you build technology like that? And it doesn't occur to anyone to check and see if all skin tones are going to respond, if the faucet is going to respond to all the skin tones. To me, those are the places where we've got to do better. We've got to have diversity on these teams so that somebody can say, wait a minute, let me try, let me be a tester. And if it doesn't work, you got to go take a few steps back and try to figure out why isn't this working well equitably, right? So it's not going to be perfect for everybody, but we at least want to be cognizant of all the people who we're leaving out of the conversation as we're building our platform. So I think those are some of the challenges, just being mindful that there are people who are not sitting at the table whose needs we want to consider. I think that's the biggie. I think the other thing is access, right? So we talk about, I think I'm saying it right, net neutrality. Everybody doesn't have access to Wi-Fi, right, to computers, to the internet. So what do you do for those folks? And we can't fix all the problems, I understand. But these are things we have to surface. So I think while we're building the technology, there's some part of it where we also have to be mindful of social determinants of health. So what do we do with the tech for people who live in communities where there's not good Wi-Fi? Maybe some of what we're doing is advocating to get Wi-Fi into those communities so that people then, right, you got at the end of the day, it's kind of a bottom line issue. If more people have Wi-Fi, more people can use my product. If more people use my product, I can sell more of it. So some of it's sort of dollars and cents at the same time that we're being altruistic and thinking about other people. So to me, those are a few of the big challenges.
Mm-hmm. Yeah, all really great points. And there are a lot of startups in our audience, and a lot of them, they think about, okay, how can we use online CBT? Or the CBT has been tested time and again, but sometimes there's not even CBT in their apps, regardless of CBT being tested. Doesn't really help. And so things like this just really extend that issue even further. And so yeah, I think I agree with a lot of the strategies you suggest too. I, ever since moving to San Francisco, was the chapter leader for Oakland and San Francisco chapter of Black Tech Women. It's like, how can we bring more people of color at the table, at the leadership level of a lot of these companies? All of these things need to happen if we're going to develop products for everyone.
Yes.
So yeah, couldn't agree more. But tell us more about, you mentioned AAKOMA Project earlier on, but the type of work that you're doing, and really how can our audience get involved?
Sure. So AAKOMA, which started off African American knowledge optimized for mindfully healthy adolescents, a whole mouthful, right? I'm really into mindfulness. I have to say there are a couple apps that I love. Calm is one of the apps, and there's Insight Timer. These are ones I use. And for littler kids, Stop, Breathe, Think. Stop, Breathe, and Think. So in that sense, technology is very useful. The fact that they have free portions of the app, and then you have, the paywall, and you have other stuff you have to pay for. But the fact that you have free gives people an opportunity. That's access, right? So as long as you got a smartphone and some kind of connection, I can go do a public event like I do for AAKOMA all the time and say, okay, at the end, I have a slide, right? Like someday I need these folks to sponsor me because I am always talking about their apps, like just telling people this is a good way to get into diverse communities, right? You just let people know what you're doing. So what AAKOMA does, what we do is we conduct research. It started off, I should say, as my research lab. So there are some people in the mental health space, if they do disparities work, they know I've been around and publishing under AAKOMA since like 1999. It goes back that far. And so we still do the same thing. It's just we do it as a 501c3 nonprofit. And it is about generating the information and the data that we then share with the mental health community. The alphabet soup, it doesn't matter what the letters are behind your name. If you're a mental health practitioner and you're invested in meeting the needs of a wide, diverse array of young people, then AAKOMA is producing research that you want to pay attention to. So we just had a book come out and the book is focused on, to me, it was super unique, right? This community engagement. That's the other thing AAKOMA is about, is how do we build on the strengths already existent within communities. So I would envision, for example, you mentioned Minneapolis. If I go to Minneapolis, first thing I'm gonna do with AAKOMA is figure out who are the gatekeepers at the community level, who are the advocates, who cares about mental health, right? And I'm probably gonna find that if they're Black, they're Somali or African American. I'm going to those people to connect with them and to sit and listen. That's what AAKOMA does. We listen and build on the wisdom, the resilience, the strengths that already exist in these communities. And then we work collaboratively to find, identify, implement, test and implement solutions. That's what we do. So the last example of something that we did was Black History Month. We had a Black History Month event. It was very multicultural. If you go to our website, on the first page, you see a picture and a video. There's a young lady with a hijab. There are kids who clearly are not Black. Some, ethnically nebulous. The point is, we want kids to know that anybody can be helped by the work that we do. That's what we're about. We want to connect these kids with quality care. We have a network of providers we work with if kids need referrals, right? And so that's what we're about, is research and outreach and care. And one of our mottos is mental health research and care for all. We want everybody to feel included. We want everybody to know that they matter. We want everybody to know that the work that we're doing is really for anybody who's felt like they've been left out of the conversation. So that's what we do, and that's what we're about at the AAKOMA Project.
That's so wonderful, and not just for the beneficiaries of your work specifically, but I think a lot of us innovators in the audience have a lot to learn from that process. I know that a lot of the entrepreneurs that I meet with are excited to impact this underserved population, but it's like you got to be in the communities and listening to people if you're really going to develop it the right way. And so I
That's
think
correct.
everyone here has a lot to learn from that. And I guess we're already running out of time. How can people get involved?
Sure, sure. So we're a growing organization. We were just fortunate to be awarded a substantial funding from an incubator organization. We haven't put out a press release, so I don't need to advertise for them, but we are so grateful to them for what they've done for us. And it's a name everybody will recognize. But what we really need are people who are willing to get their hands dirty and help us do things like comb our data, right? We're trying to produce white papers. So if you're a graduate student or have any interest in research and analytics and data, we need people to support us with that. People can go to our website at AAKOMA Project, all one word, .org, which I'm sure will appear somewhere in the online work that you all are doing. And we need people to spread the word about what we're doing. We need people to go to the website and learn about what we're doing. And we need people who are willing to come in, right? It's a nonprofit. We don't have tons of money, but we have tons of data and we have tons of need. And so helping us to spread the word about what we're doing, helping us to analyze the data, helping us to generate content. We also really need people who are experts in the social media space. We have a communications team, but we don't always have all the best ideas for how to package what we do. So we need people who can help us package it, right? Those are the kinds of needs that we have right now, just thinking long term, and I have big visions, right? I don't want to say I'm a visionary, but I have huge visions. And my vision is for AAKOMA to be global, right? So we're really looking for people who can help us scale, who can help us grow, and who can maintain the passion, right? Which is at the core of what we do, which is mental health research and care for everybody. We want everybody to feel like they have a place. So the diversity, racial, ethnic, visible diversity, queer diversity, all of that is really important to who we are and what we do at AAKOMA.
That is so exciting. And I'm thrilled to have all of our audience members check out your booth to learn more and get involved right on the left-hand side of your screen, everyone. And so thank you so much, Dr. Alfiee. This was awesome. Really appreciate your insights as always. So thank you for taking the time.
Thank you, Salome, and I'm just wishing you all the best with this amazing, important conference. I know how much work you and your team have put into this, so I'm just wishing you all the success in the world.
Thanks so much.